record it. Okay. So what we're going to do, you're going to jot down appendicular, and you need to know the parts of the appendicular skeleton. Well, we know the skeleton is broken into two parts. You have your axle, and then you have your appendicular. Appendicular is your upper and your lower limbs, your shoulders, and also the pelvis area. And they may ask what the three parts of the knee joints consist of. So you can see that listed there: medial, lateral, and the patellofemoral. So please make sure that you have the parts of the appendicular skeleton written down. As you can see, I have about 4 stars there, so you know it's going to be very important. Also know the 3 parts of the knee joint. So I'm going to need you to let me know as we move through, because you know I'm moving on through, but I will be sending out this presentation to you. So if you don't get to document everything, it will be on recording. And also I will send the hard copy attachments to you. So when we think about the musculoskeletal, just to sit there for a minute and just talk about the anatomy of it, we know that it's composed of 2 parts, because if you hear musculoskeletal, then you know you're thinking muscles and you're also thinking bones. So of course the skeleton is for our body's framework. The muscles helps with posture and also with heating. And it's important to know about the ligaments, tendons, and cartilage. So please make sure you know that ligaments are from bones to bones, tendons attach muscles to bones, and cartilage is like your shock resistance. It's like a cushion between the joints. So again, ligaments, tendons, and cartilage. Muscles we know are for heat, and the skeleton is the body's framework. Now we talk about types of muscles, and this was covered in week 2. So you please remember that you do have a handout for week 2, which covered the different types of muscles. The 2 that I like for you to focus on are going to be smooth and cardiac muscle. Smooth and cardiac muscle. And just remember, if you had to think about the smooth and cardiac, they kind of go in the same category. And you also need to know about voluntary and involuntary muscle movements. So we're talking about smooth muscle and skeletal. For example, your heart is a smooth muscle because you don't need to tell it to beat, right? So your heart is involuntary. And if I was going to raise my arm, then we know that the muscle is attached to bone, and the only way the arm is going to go up into the air is if I put it there. Then that's going to be considered voluntary. Axilla, that is consistent to be your armpit area under the arms. Now also what's different with CPT coding with the musculoskeletal is that the fractures actually, some of them are named after people. And you can actually look these names up if it's mentioned in your question, which it should be. You can actually use these terms to look up in the index. So if you see Colley's fracture, Smith's fracture, if the fracture has an actual name, you can look it up that way in the index. Just remember, You can go to fracture and then just look for the name. And we will do a few exercises before we conclude, just so that I feel comfortable with you in this material. So no worries. But you do see here, when I just have the stars, it's because I just need you to know that you're able to look these up in the index, and your term would be fracture, and then you would look for the name of the fracture. Okay, just remember that. Had someone here ask a question. If the arm is a smooth muscle, arm is considered, it is not a smooth muscle. A smooth muscle is going to be like your heart. And so you have skeletal muscle in your arm, meaning that the muscle is attached to bone. So that's why we use the example of voluntary, involuntary. So voluntary would be for like your arm, which has skeletal muscle, because it's only going to go up in the air if you put it there. And smooth muscle is like your cardiac muscle. You don't need to tell it to beat. It's going to do that by its own. And yes, I will be sending out the presentation or the PowerPoint presentation after tonight. These are just some of the diseases that affect the musculoskeletal system. Rheumatoid arthritis and osteoarthritis are the two common ones. Remember also, you have to pay attention to your ICD-10 coding guidelines in reference to the musculoskeletal system. And they do have some information in reference to the coding guidelines about osteoarthritis. So just make sure that you pay attention. For musculoskeletal, it's not that extensive as far as the coding guidelines. It's not that extensive for that particular section, but you do need to make sure that you just read about coding for osteoarthritis. And these are muscular tears of the knee. And here you also have some additional conditions. I just want you to know also that on your midterm, you will have a little bit of anatomy and terminology. That is going to stem from week 2. So just make sure you pull out some of the homework assignments that you've had previously up until this point to review as far as the terminology. So here, if someone can type in the chat box, you notice that a lot of these terms begin with the prefix osteo. What does osteo mean? Type your answers in the chat box for me. What's the definition of osteo? So if someone has like osteoporosis, yes, thank you. Yes, so osteo is pertaining to the bone. So thank you for those of you who contributed to that. That is correct. You all were correct. Osteo is pertaining to the bone. Now, in your textbook for the musculoskeletal system, when you're reading that chapter this week, please make sure that you look at the definitions of the fractures. Okay, they will be listed in your text. I don't know if anyone has their book in front of them right now. If we could share the page. Let me see if I have it here. The page that you can see the definitions of the different types of fractures. Oh, you guys are on it. So thank you. Page 236 in your textbook. Page 236 in your textbook. Thank you for sharing, guys. You can find the definitions of the different types of fractures, because sometimes, rarely, but I do want you to be prepared, they will tell you, they won't tell you whether the fracture is open or closed. They actually want you to know that. And sometimes they'll just give you the name of the fracture. So you would need to know whether it is open or closed. Okay, so this may be a set of terms that are on this slide, slide 11, that you may just want to have the definitions somewhere. Doesn't have to be a extended definition, just something brief so you can understand the different types of fractures. Nursemaid's elbow, you need to know the ICD-10 code. That is an actual diagnosis. Anyone ever heard of a nursemaid's elbow? Or how someone gets a nursemaid's elbow? Okay, so basically a nursemaid's elbow, years ago, many years ago, hopefully, it was when maids would actually take care of children. And when they were pulling them, or when they were being unruly, they would actually yank them. It's from the arm being yanked. So nursemaid's elbow, to me initially, I thought it was like when someone was cleaning the floor or something like that. But it's actually when it happens to children and they were pulled so hard that the arm was kind of dislocated. And they gave it a term, and it's called nursemaid's elbow. But for your, I believe it's in your midterm or your mock final, possibly on the exam, you may see this condition. So please make sure that you know the ICD-10 code for nursemaid's elbow. Now, it does state here that there are some illustrations. There are a few, but remember, the best place to look for illustrations to me is going to be your ICD-10 book, and you can always tab where your illustrations are, but there are a few illustrations that are located in your CPT starting on page 99 and page 100 on all the reference pages there and in between. So if you're not too keen on all the bones or what's listed, because sometimes they may give you a question and it gives you a series. They may say what bone is in between the phalanges and the carpal bones. And if you look on page 102, you'll see there that there's a diagram of the hand and you would be able to choose metacarpal bones. Okay, so just remember that there are illustrations that are placed in your CPT for your use. Okay. So this section is basically, we're talking about the treatment of fractures. And everyone that's listed on here, you're maybe going to code for homework or in the midterm. These are common fracture treatments. The ORIF, that acronym that's up top, it stands for Open Reduction Internal Fixation. I'll repeat that. I'll actually also put it in the chat box. Okay, so that you can see there, open reduction internal fixation. Anytime, I know these are some graphic images, I know you're enjoying looking at them, especially the one at the top, but anytime you see ORIF, the reason I have that image there, because that procedure, when you're reading your question, just for you to become familiar with it, open reduction means just like the picture sees, it's open and they've actually gone in and they've put in a internal fixation device, right? So that's stabilizing that bone in the foot. Open reduction internal fixation. So when you're hearing that the area was open and they inserted pins and screws, it's an ORIF procedure. The skin traction is basically a strong, I would say skin traction and skeletal well, skeletal is a little bit more extensive because that's actually screws into the bone. But the skin traction, just like the second image on this particular slide, you can see that there is tape, and they will maybe use this particular procedure for an alignment. I see someone shared the I-10 code for nursemaid's elbow. Thank you, Ashley. And they would actually, even though there's tape wrapped around the leg, at the end you can see where there's a screw. That's actually attached to some type of pulley, and they wind the pulley to manipulate the bone or the leg back into its normal anatomical position. Skin traction. And cast application we're all familiar with. We know exactly what that is. But these days they have alternative cast applications. Some people have, I've seen like the little space boots. So basically it's surrounding the fractured area. And skeletal traction is the example there is the last picture. And with that particular example, they have actually inserted screws or the pulley into the bone itself. And then you can see the pulley where they would actually wind that to do the alignment. Some real interesting. I think the ORIF was the most interesting for me. I thought it looked really exciting. All right. Coding tips. It's time to wake up. Okay. This is what it's all about. Okay. When we are coding for fractures, these are going to be important tips for us to know before I start to go through the pages and give you things to highlight and star and things like that. There are a few things that are important for you to know in reference to coding for musculoskeletal. I think you guys have executed integumentary, and I would like it to be the same for musculoskeletal. First of all, step 1. Where is the procedure being performed? Okay. Remember, we're now not in integumentary, so we're not going to be having procedures performed on the skin. We're starting to move into the deeper layers. So is the procedure being performed on the soft tissue or on the bone? That is the first question that you would need to ask. Is the procedure being performed on the soft tissue or the bone? Second, is the treatment for a traumatic injury or a medical condition? Is the treatment for a traumatic injury or a medical condition? So when I say a traumatic injury or a medical condition, okay, so a traumatic injury could be a car accident, right? And the car hits the tree, and now this person has suffered a fracture, maybe to their leg, opposed to a medical condition. What is a medical disease that affects the bone? Type it into the chat box. A medical condition that affects the bone. Yep, we have arthritis here, osteoporosis. And just remember, arthritis is going to maybe affecting the joints, because when you think arthritis, you're going to think arthro, and arthro meaning joint. osteo, yes, osteo is going to be for the bones. So yes, but you did give me some good examples. Yes, osteoblast there. So as long as you understand the difference between traumatic, right? So that's from outside cause or outside causes, or a medical condition. So a disease that's created from within that's affecting the bone. So that's something else you need to ask. And the reason they have number 2 in reference that I have that there as a coding tip, because if there's a fracture, if you're coding fractures, you need to know, is it a traumatic fracture or is it something from internally, from a disease? So it's important to know whether it's from a traumatic injury or from a medical condition, because when you go to fractures in ICD-10, it is divided that way. Okay, so make sure when you're reading the question, if they're talking about fractures, that you ask yourself, is this from a traumatic injury or from a medical condition that the patient already has? Another step that's important is to identify the site, right? I have the vertebrae. I have CTL there. Does anyone knows what CTL stands for? They're acronyms. Yep, C for cervical. What about T? T for thoracic. What was the last one I had here? An L. An L for lumbar. So if you guys didn't know that, thank you guys for sharing. Ashley and Lauren and Henry. If you guys didn't know that, please make sure you understand, because sometimes they will make a statement and say that a procedure was performed on the C1 through C2, and you need to know that C1 through C2, they're talking about the cervical area, so you'll know which section to look for. Okay, so again, you need to identify in some of the questions what part of the bone are they performing this procedure on, or what is the name of the bone? Is it a cervical, thoracic, or lumbar area? Those are questions you would ask. Step 4, does your code include grafts or fixation devices? Okay, they may not say fixation device, but if they're using screws to repair injury, or if it's included in part of a procedure, that is considered to be a fixation device. And if they are using a graft, it will be spelled out that way in the question. You won't have any confusion. But it's important to know whether they're using fixation devices or grafts in the procedure, because that's going to affect your CPT code selection. And just like moving on to number 5, just like with the integumentary system that we covered, just like with integumentary, how we had, remember we had like each additional 10 or part thereof, or we also had codes that had single or multiple. So just make sure you're looking and you're reading to see if it's single versus multiple areas that are being treated, and also the medical terms. And sometimes we may not understand all of the definitions for the medical terms, but sometimes if you can look up the term using your I-10 book, at least you can know the body area. Most of the times they'll have a few images and you'll know the body system that they're referring to. Okay, so these are some of the coding tips that I think are very important. Make sure you know what the extent of the procedure is being performed on, whether it's just on the soft tissue or if it's going to be extended down to the bone, because that's going to affect your code selection. Also, when they're treating the injury, is it something caused from a outside force or from a medical condition. Again, the bones. This is important too with fractures. You need to know the name of the bone or the anatomic site, whether it is cervical, thoracic, or lumbar. And then if you're using any outside devices such as grafts or a fixation device, remember fixation devices are considered to be like pins and screws. Those are internal fixation devices. They also can be percutaneous, which means through the skin. And then whether the code that you're selecting, is it for single versus multiple? And again, the medical terms. So those are some of the coding tips. Okay. All right. Keywords, right? So when we're reading questions, these are the key words we're looking for. Remember, when we're coding procedures, you're coding the action. What are they doing? That's what you're coding. What is the action? What are they getting ready to do to this patient? All right. So we spoke about a couple examples for incision in the integumentary system. So it's going to be the same way, right? But they're going a little deeper now. So let's start going through some of these pages in the CPT. So right now I am on page 104. Page 104 in the CPT Professional under the musculoskeletal system. I just wanted to bring to your attention that they do have a lot of the definitions here that you're going to need to know. We're on page 104, right underneath definitions, you'll see closed treatment. That's something I want you to highlight in your book. I need you to highlight that. Highlight closed treatment. And then I also want you to highlight where it says the fracture site is not surgically opened. Okay, so when it's a closed treatment, the fracture site is not surgically opened. Okay, and now you can see, this is great information. With closed treatment, we know that the fracture site is not surgically opened, and these type of procedures are treated with 3 methods. Do you see that there towards the end? The first one is without manipulation, with manipulation, or with or without traction. So when you're reading your question and they're talking about the treatment of a closed fracture, these are the code selections. They'll have what type of treatment it was, but it will give you 3 selections. And so you're looking to see with or without manipulation, or with or without traction. Okay, and so if you need to know like what would be an idea of manipulation. So manipulation is like, let's say I got into a bar fight and my nose was knocked out of place and now I've gone to the emergency room. If the provider takes forceps and just realigns, that's manipulating it back into its normal alignment. So that's considered to be manipulation. Okay, that's considered to be manipulation. Okay. Going down, open treatment, make sure you highlight open treatment. And right next to that number 1 there, it says surgically opened. Yeah, self-explanatory, right? Surgically opened. And look, when they're doing open treatment, this is where you're going to read or know more about the intramedullary nail. Okay, do you see that term there? They're going to place that type of nail across the fracture site when it's an open treatment. Okay, so make sure that you highlight the open where you have open treatment. You're going to highlight open treatment, surgically opened. And then where it has number 2, the fracture bone is opened from the fracture site, in order to insert the intramedullary nail. And then the third is percutaneous skeletal fixation. Percutaneous skeletal fixation. Make sure you highlight that. And look, it tells you here that particular treatment is neither open nor closed. But they do say here that they will use fixation devices, example pins. So I highlighted pins, but they use X-ray imaging. In the open treatment, if you go back up one to the open treatment, it's the last sentence. It says the fracture site is not opened and visualized, but with the percutaneous skeletal fixation, they visualize it. Usually they state here under via X-ray. Okay, and I just gave the examples there on the different types of fractures with the images. Those are listed right below. So right underneath percutaneous skeletal fixation, skip a paragraph, skip the next one, then you'll see skeletal traction there. Okay, and then you'll see skin traction, and then external fixation. I need you to highlight those three terms. And then on the other side, on page 104, you'll see the definition there for manipulation. Make sure you highlight manipulation. Okay, I'm on page 105. And on page 105, where it says radical resection of soft connective tissue tumors, so I want you to make sure you write tumors right along the side of that, because it gives you information on how to code for the tumors. Okay, so make sure you read that, put a star there to read that section. And then moving on to the incision under general. Okay, so for incision, we're talking about procedures like incision and drainage, right? So that's the only one that they have under the incision category. Okay, so for incision and drainage. Then you have on page 105, wound exploration. This is going to be the questions that would drive you back to this particular area in your exam or in your homework or on your quiz are going to be questions like in reference to gunshot wounds. The patient will always have received a gunshot wound. What you need to pay attention to in this particular section is just going to be the location. Okay? So on the side of that or somewhere near, you may want to put where is the location or what is the location? Okay, under wound exploration. And you can see on CPT code 20100, the location there is the neck. Make sure you highlight neck. CPT code 20101, location is the chest. And CPT code 20102, they have abdomen or flank or back. And remember, that's also the trunk area. So you can write trunk next to CPT code 20102. And then 20103, extremities. Remember, your extremities are your arms and your legs. So you can write arms and legs there. And moving on down to the excision category, which is the second bullet point on this slide. We're still on page 105 in the CPT. Under excision, you see this one says with or without. Make sure you have your highlighters. With or without autogenous soft tissue graft. Make sure you highlight that. And make sure you highlight epiphyseal bar right at the top next to excision. And then with CPT code 20200, you can notice that this is a biopsy. Where is it coming from? The depth is the muscle. And now how deep did they go? Is it superficial or is it deep? Okay, so make sure you highlight those two terms, superficial and deep. I'm on page 106 under the introduction category. So under the introduction category, I did biopsy, right? So 20200, make sure you highlight it. It's a biopsy from the muscle for CPT code 20200. And then on page 106, you can still see at the top CPT code 20206 that this is also a biopsy of the muscle, but now look at how they're doing it. Percutaneous needle. Percutaneous needle means through the skin. Okay, through the skin. Percutaneous is through the skin. And then on CPT code 20220, they're still taking a biopsy, but it's a biopsy of the bone. Okay, so remember, that's how deep did they go. 20206 is the muscle, 20220 is the bone. And 20225, you'll see the keyword there, deep. Same thing, 20240, biopsy of the bone. Now this is open. That trocar or needle on 20220 is more of like a laparoscopic type procedure. You'll see the terms trocar when they're doing laparoscopic procedures, meaning that it's minimally invasive. But on 20240, this is an open procedure. So these are key words for me. I want to know about the bone and then which one is minimally invasive and which one was performed actually open. And again, if you have any questions, please feel free to put them in the chat box as we move along. We're still on page 106. Under introduction or removal. Okay, so these, I wrote injection here because that's where your injections are going to be coded also. Okay, like CPT code 20500, injection of sinus tract. And then 20520, removal of foreign body. That's going to be a common procedure. You may want to put a star next to that CPT code. Removal of foreign body in the muscle. And this is simple. Or 20525 is deep or complicated. And then you can see 20526 through 20550 are injections. And then you're just looking for the type of injection. So you can highlight injection, put a box around therapeutic. For 20527, put a box around enzyme. In 20550, single tendon sheath or ligament. This is going to be a need to know. CPT code 20552 and 20553, those are need to knows. Actually 20555 also. These are called trigger injections. So what I would do is draw a line from 20552 all the way to 20555 and write trigger on the inside of that. And I just want to talk about these two of the codes on this page, the 20552 and the 20555. The 20552 code is a trigger point injection right? You're going to highlight where it says 1 or 2 muscles. That code 20552 and the 20553, those codes are used when the patient does not have a procedure, right? They're coming in to get a trigger point injection, but they didn't have a major procedure along with that injection. However, CPT code 20555 is also a trigger point injection, but it is at the time of or subsequent to the procedure, right? So with 20555, that means they had a procedure and they're getting the trigger point injection. With 20552 and 20553, they're just coming in for a trigger injection. Injection only. How about that? Injection only. Okay. Next to 20555, you can put with procedure. With procedure. Trigger point injections, right? So you can check that off your need to know list, or you might want to write trigger point injections on page 98 and put where you can find it, which is on page 107. Let's do this as we go along. Right? So on page 98 in your CPT book, first need to know you need to have is the trigger point injections and where they can be found, and that is on page 107. If I say, talk to me and tell me about trigger point injections, you're going to say, okay, Geneve, CPT code 20552 and 553 are for the injection only, and CPT code 20555, they're going to have the injection along with a procedure. Did we get that? If yes, give me a yes in the chat box. Wonderful. This is great, right? You're in your space, you have your books, and we're focused and we're getting in these books. It's important to have all these notes in the books. I think they're starting to get decorated a little bit. All right, moving along, page 107. You want me to repeat? Sure, no problem. One more time. Trigger point injections. We're going to find them on, I've said 107, but it's actually on page 106. Page 106, CPT code 20552 and 20553 and 20555. They're all considered trigger point injections. 20552 and 20553, when the patient comes in, all they're getting is the injection only. So those two codes are injection only codes. CPT code 20555, CPT code 20555, they're going to get an injection, but it's done at the same time as a procedure. So they could be having another surgical procedure done in that particular area, and then they treat it with the trigger point injection. You would use 20555. When you're choosing or selecting for the injection only, you're going to pay attention to the number of muscles that are being injected. The number of muscles. All right, so that takes care of introduction and repair. Let's see, where are we? We're on page 107. Down the center, you can see the trigger point injections. It has a little image on there on page 107 where you can see the site of the area. I actually highlighted that little tailbone down there, but you can see the point of where they actually perform that particular procedure. Okay. The next set of codes are arthrocentesis codes. Arthro meaning joint, centesis meaning that they're withdrawing fluid. Okay, so you can see CPT code 20600. It says here small joint. Do you see that? Small joint for arthrocentesis, so make sure you highlight that. In CPT code 20604, highlight where it says with ultrasound guidance. Okay, with ultrasound guidance. So you see that's ultrasound guidance, right? And I said before you ever pick your CPT code, before you choose your CPT code, you always want to look and check what type of guidance is being used, because as you can see in CPT code 20604, it says ultrasound guidance, but if you go down to the second set of parentheses, it says if it's fluoroscopic guidance, a CT or MRI, if they use that as the guidance, then it's referring you to different codes. So I would draw a line with a little arrow to that second set of parentheses and make sure you remind yourself to read the type of guidance. What type of guidance is being used? Okay, and someone had a question here. If there's multiple muscles, would you use, oh, you mean like the time sign? I think that's what you mean. So if there were, well, you wouldn't need to use a time size, because if you look at CPT code 20553, it's just 3 or more muscles. And 20552 is just 1 or 2. And if it's 20555, the amount of muscles don't apply at that point because they're actually doing a major procedure already. No problem. All right, and so moving on to arthrocentesis, we've highlighted and put some instructional notes there to make sure we pay attention to the type of guidance. 20605, make sure you highlight where it says intermediate. And the same thing as 20606. The same rule applies if they have to use any type of guidance. Right underneath it, it will tell you. 20610, arthrocentesis. Make sure you highlight where it says major joint. And make sure you highlight in those examples there, knee. Make sure the knee stands out. And also see that it says without ultrasound guidance. And then 20611 is with ultrasound guidance. All right, moving on, we're on page 108. Page 108. Make sure you put a star next to 20664. That's for the application of the halo. 20664, application of the halo. You can see the little image right underneath on page 108. Okay, so they have a couple of codes for that halo procedure, right? So the 20664 is for the application. 20665 is for the removal. And 20670 is removal of the implant. And if you ask what an implant is, they have them in the parentheses there, examples, the wire, the pin, or the rod. And anytime you see separate procedure next to a CPT code, do you see that there's separate procedure in parentheses? That means it's a procedure that's usually not billed with another procedure, right? And if it is billed with another procedure, you would need to append modifier 59. And moving on down, you can see some of the examples of the external fixation devices. External fixation. And then on page 109 is going to be important. You can see at the bottom there, this is where the codes for the graphs, they start to talk about the codes for the graphs. So on page 110, that's where I would write muscular, these are the graphs, but graphs for musculoskeletal system, graphs on top of page 110. Looking at, you need to know the name of the graphs, and of course that will be in your question. CPT code 20900 tells you about the bone grafts, and you can see it just gives you the names of all the different types of grafts. So these are the grafts. And then on page 111, we start to move over to procedures for the head. Sometimes they'll say a patient had like soft tissue removed. They're also going to be considered tumors. So where you see CPT code 21011, this is going to be a tumor that's going to be located in the head. And what's important for you to know is going to be the size of the tumor and the location. When you have questions about tumors, sometimes they'll say soft tissue, but it still goes under tumors. Okay, so these are going to be excisions of the tumors on from the head, starting on page 111 all the way to page 112. And then they'll have codes, other procedures for the head, like the prostheses. They don't really ask questions from this particular area, but I just want to go over it with you. And then as you turn to page 114, these are going to be procedures on the mouth, on the mandible. Page 116 is where I am right now. You can just see, again, they're talking about the tumors because it says soft tissue, but this time you're just looking at the location. So let me tell you how it's set up. So you can see here, like on page 116, that these are going to be procedures on the neck. And once you see soft tissue, you already know, okay, soft tissue means tumor. And so that's going to be under the excision category. Remember, your incision is just going to be for like your incision and drainage, right? Then we get to excision. Excision, they're talking about excising the tumor. And again, what would you do? You would just look for the location. Here it says the neck. And then the second step is going to be the size. The size. On page 117, they're going to continue with other procedures on the neck. As you can see here on page 117, now they're talking about fractures and dislocation. But again, you can always go to the index and then just look for fracture and then look for the area. So we're just moving on to the body parts. You can see it's very repetitious. This is the back and flank on where you're going to have the tumors located in the back and the flank. Right? Flanks are basically the sides, your sides. Right? Page 120 is where I am. It's going to be a lot easier when we do a few examples. Just want to make sure get through these with you. And again, remember to get your terms, but you've already put a star on the page that gave you the definition for like closed treatment, manipulation. So just remember the page where those definitions are, then you don't have to write them down. All right, I'm on page 120. As you can see here, this particular page are procedures on the vertebrae. So I actually just wrote vertebral on the top of that page, on top of page 120, vertebral. Okay, so that's the vertebrae is what they're talking about. These are CPT code 22315. They're talking about the treatment. You'll see that 22305 through 22315 are closed treatments, right? Remember, you're going to have to know how they treated the fracture, whether it was open or closed, and that's going to be in your question. If they do not state whether the fracture is open or closed, we're always going to assume that it was a closed fracture. Please remember that. If it does not state whether the fracture is open or closed in your readings, you are going to assume that the fracture is closed. Okay, we can't just assume that someone has an open fracture. So if they don't mention it, you're going to code it as closed. But you can see there is codes here for closed in reference to the vertebrae, and then starting CPT code 22318, you'll see that there is open. And then remember, when it's an open fracture and they're treating the fracture, you need to know if there's any fixation device or grafting, right? So just remember at the top, is there a device or graft? That would pertain to this particular page. Okay. Page 121. Make sure you put a star and highlight this first sentence at the top of that page. First sentence at the top of page 121, where it says vertebral augmentation is the process of cavity creation, followed by the injection of the material. So they may ask, I have that highlighted. I actually have a star. So I'm pretty sure you're going to see that again. And this is vertebral augmentation, right? At the end of that sentence, so there's the vertebra and there's the sacral or the sacral area. And it tells you for augmentation, you're going to code it here. But if it's for sacral, it's telling you to use a new technology code. Do you see those two codes? 0200T as in Tom and 0201T. Okay. So that's if they mention sacral, so you know where to go. You would use a technology temporary code there. And at the end of the second paragraph on the same page, the last sentence, halfway through the last sentence, it says sacral procedures are reported once, only once per encounter. Please highlight that. Okay, so vertebroplasty means they're repairing the vertebrae, right? So you want to know at what particular area, and if you're looking at CPT code 22510, vertebroplasty is simple, right? Because you can go straight to the index. It's a procedure word. You can look it up right there. It would have sent you right back here. But 22510, make sure you highlight the last word in that definition, which says cervicothoracic. CPT code 22511 is lumbrosacral. And CPT code 22513, make sure you highlight there where it says thoracic at the end. So they're repairing the vertebrae. And they're telling you at what section of the vertebrae: cervical, lumbosacral, or thoracic. These are called vertebroplasties, and I can guarantee you're going to have a question about that on your exam. Let me see if I had that on my... Yep, I had that on my need to know. So make sure you put that on your need to know. Vertebroplasties, and those start on page 120. So right now, let me just tell you a few need to knows that we've actually already covered. The first one is the trigger point injection. Right? We know what page to go to. That's page 107. Then we spoke about fractures, on how to look those up. Fractures start on what page in the index? That's page 855. And there's 3 steps when you are coding for your fractures, right? You need to know the name of the bone. The name of the bone, step 1. Step 2, whether it's open or closed. And step 3, with or without manipulation. With or without manipulation. Okay. And then we also looked at a few injections, and that's going to be under the introduction category. Injections are going to be found under introduction. And then you needed to know the definitions for manipulation and reduction. Manipulation and reduction. And then we were talking about the tumors or the soft tissues. Sometimes you'll hear the word lipoma, L-I-P-O-M-A-S. If you hear the word lipoma, tumor, or soft tissue mass, it's going to take you back. Where were we coding those lipomas? Well, you need to know the body part, right? You need to know the body part, and then you also need to know the size. So the location and size. And I believe the tumors started from page 116, where we was looking at the example of tumors of the neck. So you need to know the location and the size. And remember the terms that they can be called: lipomas. They'll maybe say soft tissue, or tumor. Right? So we got that there. And vertebroplasty, we just wrote that one down. That's page 120. And you also need to know the definition of that acronym ORIF. Anyone remember what that stood for? If you could put it in the chat box, ORIF. Open reduction, internal fixation. It's a lot of writing. Okay, so on this slide, I just have a few definitions of those terms, but you also have them in your text. Anybody have I think we gave the page number for where we can see the different types of treatments, like the one I have here on the slide: close treatment, manipulation. Anyone have a page number in the textbook we can share? Let's make sure that you guys read and get the definitions. Get those in there. I am now on page, where are we? Skip that one. All right, I'm on page 124. Page 124, 124. Just want to make sure everybody's still there. Can I get a yes, I'm still here in the chat box, please? I miss not being able to see all of you. All right. Are we doing okay? So quiet. I'm used to interaction with you guys. All right. No problem. All right. So we're on page 124. And I'm looking at the spine deformity. So this is talking about individuals that have a deformity of curvatures in the spine, scoliosis. Right? Arthrodesis. Well, I'm looking at CPT code 22800. Desis means to fuse, so they're fusing the joint. Arthrodesis. Arthro meaning joint. So on CPT code 22800, the location is what's important, so make sure you highlight posterior, posterior. And then you need to know the key thing on this page is the number of segments, the number of segments. With CPT code 22800, you can see there it's up to 6 vertebral segments. And as you go down, it increases 7 to 12 and then 13 or more. And then with CPT code 22808, you'll see that's going to be the segments for the anterior section. So make sure you highlight posterior in 22800 and anterior in CPT code 22808. Okay, I'm on page 125 under spinal instrumentation. This is an area where you're going to put a little star. You'll be using that for your reading pleasure. First thing I want you to highlight there is that those first two terms, segmental instrumentation. These are just giving you definitions of what segmental and non-segmental mean. So with segmental, there's a fixation device at each end. And when I say, and then non-segmental, with non-segmental, there's also an attachment at each end, but it's also, it's not attached to the intervening segments. So they have an example of non-segmental spinal instrumentation on page 125. And it tells you how to report them too. So spinal instrumentation is on page 125. Okay, and that's also a need to know. You need to know where to go to find spinal instrumentation. So you need to make sure that you write that on page 98. Spinal instrumentation is found on page 125. That's where it starts. That's where it starts. So you need to know if it's posterior. Well, they'll tell you in your question whether it's segmental or non-segmental. That's not something you're going to have to try to figure out. You're also going to need to know what a vertebral segment is, and that's also on page 125 in that explanation there. It's about the 1, 2, 3, 4, 5th paragraph, vertebral segment. Okay. So again, we're still talking about the segments on page 126. CPT code 22842, that's the posterior segmental instrumentation. These are add-on codes, right? So it tells you what codes you can use them with. And the other one was 22845. That's for the anterior. So basically, you're looking again for the number of segments. And once we do a question, it will make more sense to you. Musculoskeletal, just so you know, it may sound like we're highlighting a lot, but this is not a section that anyone doesn't do well in. They always do well with this particular section. The codes, just like how we were doing process of elimination and talking them out with integumentary, we do the same thing. It's a lot easier It's a lot easier with musculoskeletal because the CPT codes are very distinct. They don't have them too close together. So they all have their own distinct meanings and definitions. So you should feel comfortable with this particular section. That's what I say anyway. You should feel comfortable. All right. I'm on page 127. Put a star next to CPT code 22857. Make sure you highlight where it says total disc arthroplasty and also where it says anterior approach. Okay. And right underneath that CPT code 22857, I want you to put L as in Larry, L5-S as in Sam 1. L5-S1. That means it is at the 5th lumbar. Actually, it's the last one, the last segment, and the first segment of the sacral area. That's L5-S1. Under CPT code 22861, make sure I actually just wrote revision out on the side and highlighted the term revision. So this is in reference to total disc arthroplasties. They're repairing the bone in a particular segment. For 22857, it's the one that's the last bone from the lumbar and the first sacral area. In 22861, they're just revising it, doing a revision. And in CPT code 22864, it's actually the removal. And with 22861, you can see they're talking about the cervical area. And in 22862, it's in reference to lumbar. So just make sure you are able to distinguish the various areas. And as you turn to page 128, you'll see this is abdomen and they're back on the tumors. So again, you're just looking for the size. So you can see they've kind of sectioned the body parts off together on how they repair them. Because if you look on page 130, this is going to talk about the fractures in that particular area. What else do you guys need to know? On page 131, under amputations, make sure you highlight amputations. And that is a need to know. Okay, so you need to put amputation and re-amputations. Yep, sometimes that stump tries to grow back. That's a re-amputation. And what page can we find those on? Page 131 and 144. I have 144 here. Let me see why. Yeah, the amputations there too. All right, so your amputations can be found on 131 and 144. And you can also go to the index, right? The index page for amputation is on page 779. And then you're just going to look for the area of the amputation, the area. All right. I'm also on page 135. I think that's where there's also codes for amputations on page 135. And then there's that code for the re-amputation, CPT code 24930. Make sure you highlight that and put a star next to it. CPT code 24930. right? And then there are procedures for the forearm and wrist. I'm on page 136. Put a star next to CPT code 25246. 25246. And where it says injection and wrist. I'm pretty sure you're going to have a question on that because you know carpal tunnel syndrome. They're maybe going to ask you a question about that, the injection of the wrist. Okay, going on through. And then on page 139, you can see again, we're just going, it's the same procedures, just different body parts. Main thing you have to do with musculoskeletal system is where are we getting ready to do this procedure? Okay, where are we getting ready to do this? So, and what are we getting ready to do? Actually, it's the same thing for all of the most of the chapters. Right. I'm on page 143. Page 143. Page 143. And I'm looking at CPT code 26607. 26607. Make sure you highlight where it says closed treatment, because this is talking about fractures, right? So remember, when you're coding fractures, there's a couple of things you need to ask yourself. And it does tell you right at the top on page 143, it gives you a coding tip. Reporting for categories of manipulation and/or fractures. So it tells you here the codes for treatment of fractures and joint injuries. So joint injuries are considered dislocation. Let me tell you, if you ever read, because there's codes for dislocations, right? You can have a dislocation of the shoulder, and you can also have a fracture of the shoulder. So if you ever read a question that states that the patient had a dislocation and a fracture of the same area, you do not code the dislocation. You will only code the fracture because that is the most extensive of the two. To get the fracture, it had to become dislocated anyway, so you're not going to code both. You will only code the fracture. So again, back to page 143, the codes for treatment of fractures and joint injuries, such as dislocations, are categorized by the type of manipulation. Remember, manipulation means reduction, same thing. Reduce or to align back into its normal alignment. So categorized by the type of manipulation and stabilization. Okay, so stabilization here, they're giving you fixation or immobilization devices. Okay, that's stabilization. These codes can apply to either open, so they're saying compound fracture. So now that you know, a compound fracture is an open fracture, but it says it can apply to either open or closed fractures or joint injuries. Okay? So what these codes on this particular page on 143, they're just talking about the type of fracture and whether it's open or closed. So metacarpal fractures, CPT code 26607, 26615. Make sure you highlight the name of the fracture. One is closed, one is open, one is percutaneous skeletal fixation, right? But it still all applies to the metacarpal fracture. It's just how it was treated. So that first setup there is for metacarpal. And then you drop down to CPT code 26641, and that's carpometacarpal, right? So we're like carpal tunnel, right? And then you can see some of them are closed treatments. Then you drop down to 26650, and that's percutaneous or 26665, that's open. Carpo, metacarpal. So then basically on this page, you're trying to find out, you know what type of fracture it is, you just are reading in your question to see the type of treatment that's being provided. Page 144. These are just procedures on the pelvis and hip. Again, broken up into the same categories: incision, excision, introduction, removal, and then by the time you turn to page 147, they're talking about the fractures for those areas. So they're all grouped by body part, all the procedures in this section. I'm on page 148. Page 148. Put a star next to, these are treatments of the perichantric, CPT code 27244. Put a star there. Perichantric. I need you to highlight that. And also highlight where it says femoral fracture. That's a common one. And page 149, you can see it starts the procedures on the thigh region or the knee. Again, starting with the tumors, you can see CPT code 27323. These are just biopsies. And again, when you're doing tumors, lipomas, soft tissues, this is the area you'll be in. And you just need to pay attention to the size. Am I putting anybody to sleep? Are we okay? Or are we just highlighting and moving along? Okay. All right. Good to go. All right. Page 150. Page 150 in your CPT, next to the introduction or removal category, again, this is going to be an area for injections, right? And a common procedure will be injections for the knee. But CPT code 27370 is injection of contrast for the knee. Put a star next to that. And on page 151, put a star next to CPT code 27420. Make sure you highlight the first term, which states reconstruction. And put a highlight or a box around where it says patella. I actually wrote patella out next to my CPT code. I'm pretty sure you're going to get a question from there. And 27422, make sure you highlight where it says realignment and muscle. Okay, I'm on page 152. Page 152. Put a star next to CPT code 27506. 27506. Remember in the beginning we were talking about ORIF? See if you can remember that. That's 27506. ORIF. That was the open reduction internal fixation, right? So 27506, you already can see it says open treatment. And remember the image of the open treatment of the foot, you could see the screws there. So that's why it has with or without external fixation. So you don't have to have anything applied from the outside. It includes whether you do or whether you do not. And it says with insertion of that intramedullary implant. Remember that was like your screws or locking screws. That's what they call it here. So this is a common CPT code when they do a, because the femoral shaft is an area that gets injured frequently. And they do like to ask questions about ORIF. I actually wrote that next to the CPT code. I wrote the acronym ORIF and I put a star and I highlighted femoral shaft and intramedullary implant. All right, on page 153, CPT code 27560. 27560. It has closed treatment, okay? 27562. So they're treating the kneecap. It's a dislocated kneecap. 27560, there's no anesthesia. I don't know how that works. Not really sure. But with me, I would be doing a 27562, which is requiring anesthesia. Make sure you highlight that so you can distinguish between the two. When there's a closed treatment, I have no staples. I don't know why I have that written there, but I suggest that you write that there too. No staples are used next to 27560. 27560. Turn to page 157. 157. And the good thing about this again, guys, is that it is being recorded. Once I figure out how to save this file, I'll be sending it to you. But I think it does do it right after. So I'll send that as an attachment along with the homework for musculoskeletal. Right. And as you can see on this slide here, we're just kind of going through all the pages. But where it has formatted by anatomic site, we already know that. If you look at page 99, that's your reference page. It's just breaking it down the same way. It's just that in the book now, it gives you more detail on where to find the exact procedures. Okay. And again, keywords, I just want to keep revisiting some of the keywords that you need to pay attention to when you're looking up musculoskeletal procedures. I'm just going back and forth, just a little bit of reinforcement. Key terms like incision, excision, introduction, removal, repair, fracture and or dislocation, amputation. These are keywords, right? You can always go to the back too. You can always go to the index and look for excision. But you need to know your body part and what's actually being done to that body part. All right. For example, I'm on page 157 right now, and as you can see, it's going through all the body parts. Right now, we're on foot and toes, and under the excision department, the excision section, you can see again, with excision, we start with tumors, right? The tumors, soft tissues, lipomas, those are going to fall under this section. You would know the body part. All you would need to know is the size. Okay. Page 158. Page 158. At the top of the page, I have that you need to know the name of the bone. So make sure you have the name of the bone written at the top. For example, CPT code 28111. Ostectomy. Osteo mean, you know, the osteo meaning bone. And ectomy, they're removing something, so they're doing an excision. And here it tells you of the metatarsal head. So that's the part of the bone or the location. So you'd want to highlight metatarsal head. Also put a star. This is actually a term I have written in here, need to know, next to CPT code 28120. They're going to talk about a sequestrectomy. Make sure you highlight that term and that you put it on your need to know page and where you can find it, which is on page 158. Page 158. So CPT code, make sure you write the term sequestrectomy. and where it can be found on page 158. You could even put the CPT code there too, 28120. 28120. On page 160, did I have you guys write spinal instrumentation down for your need to know also? Spinal instrumentation, we just looked at that for a little bit. That's on page 125. On page 125. Spinal instrumentation. On page 160, these are procedures for the foot. And these are great, right? Because they're already going to be given the name. Remember we had the little slide that showed the different names? It will show you the name. Okay, so these are the procedures for the feet. On page 160, don't think they really ask any questions from there. I'm on page 163. Page 163. Under other procedures, put a star next to CPT code 28890, 28890. And the acronym I want you to write on the outside is ESWT as in Tom. That stands for extracorporeal shockwave therapy. What's important on this code, why I wanted you to star it, is because I need you to highlight. First, make sure you write ESWT on the outside of the CPT. And then in the definition where it says high energy, highlight that. And towards the end of the definition where it says involving the plantar fascia, remember that's the all that meat in the thigh area, coming from the thigh area. Now, I had you highlight high energy because when they're delivering this particular procedure, if they're doing extracorporeal shockwave therapy, you're looking to see the type of energy, whether it's high energy or low energy. So 28890 is for high energy. Now take a look right underneath it in the parentheses. It tells you for extracorporeal shockwave therapy involving musculoskeletal system not otherwise specified. It shows you those technology codes, right? Those temporary codes. So right next to that, I want you to put low energy. Low energy. Those are your low energy codes. So if it has to do with extracorporeal shockwave therapy or ESWT, the question you are to ask yourself, is it high energy or low energy? And again, we're going to go through a couple of questions before we wrap up tonight. So I know it's a lot of talking, but I enjoy that you have the opportunity to make all of these pretty decorations in your CPT book. All right. Applications and cast. That's where we are now. I just want to give you a little heads up on cast application. This is a rule. Okay. With cast applications, here's how it works. You can't usually bill for the removal of the cast, right? Whoever applies the cast, it's kind of bundled into their reimbursement of the removal. Okay, so they're like, okay, well, if you're going to put it on, you're going to be responsible to take it off, and don't try to charge us or bill us when it's time to take it off. So it's already included. Okay, it's included with the provider, him billing the procedure to apply the cast. So applying the cast also includes taking it off, right? However, meaning if you apply the cast, if you're going to bill for applying the cast and taking it off, there's a couple of things that you need to make sure you know. So let me go into that area for the cast and strapping. So on page 163, make sure you put a little star there because it tells you when you can and cannot bill for the cast. Look at the second paragraph on page 163 at the bottom. It says, an individual who applies the initial cast, strap, or splint, those three examples are important, highlight them. An individual who applies the initial cast, strap, or splint and also assumes all of the subsequent fracture, dislocation, or injury care, this is important what's coming up, cannot use the application of the cast and strapping codes as an initial service, since the first cast, splint, or strap application is included in the treatment of the fracture. You get it? Let me just summarize it. Basically, if you're going to treat it and you're going to fix it, you can't bill for the application of the cast. But let's say we were in I'm always using a car accident and we ended up in the emergency room, right? As long as that ED doctor did not perform any type of surgery and he applied the cast, he can bill for the cast because he's not doing anything. He's like, here, I'm going to put this on temporarily. You can follow up with your physician in the morning. He can do the procedure for you. If it happens like that, then the hospital or the ED physician can bill for the application of the cast because he didn't do a surgery. But if they're going to do a surgery and apply the cast at the end, they cannot bill for the application of the cast because the surgery is more extensive and they're like, you weren't going to perform a surgery and leave their arm just hanging. So that's going to be part of the procedure. Does that make sense? Okay, so the only time you can bill for the cast application is if there is no surgery being performed on that area. No surgery, meaning manipulation, reduction, that's still a procedure, right? But no major surgery, you're not going to bill for the cast, right? So that's what that little segment is all about at the bottom of page 163. And on page 164 is just basically the areas where the casts are going to be applied, right? So CPT code 29000, you can see it falls under cast and it's the halo, right? So it's just upper extremities and then it's broken down into lower extremities and then removal or repairs. Okay. Endoscopy, arthroscopy, I'm on page 165. We're moving right along. Anyone have any questions so far? Take a minute to just wait to see if you guys have any questions. You can type them in the chat box. Or if I'm good to go, just let me know. No questions. Good to go. Good to go. Everybody's like, yeah, let's just keep it moving. Oh, Elaine, you asked about the midterm. The midterm is actually going to be next week. Just a reminder, if you guys were not here in the beginning of the call, usually when we do a midterm, you take the midterm and as soon as it's completed, you leave. We don't have class that day. So it would be that the midterm would fall on next week, Thursday. So I do not want to send that. I'm going to send the midterm to you, but it is your responsibility to get the results back to me by Monday morning so that I can review them before that following Thursday class, which will be at the location for sure. Okay, on the midterm, how many questions on the midterm? Yeah, sure. So 75 questions are on the midterm. But on your mock final, like the ones that just did that last week, they had 150. But you will have 75 questions on the midterm. And I do want you to kind of time yourselves because we haven't really been doing that. You need to make sure you time yourself 2 minutes a question. Yes. So your midterm will be taken at home on Thursday. So you will not be coming into class on Thursday. I will be sending you that midterm attachment Thursday morning. I'll be sending you homework for tonight, of course, because we need to cover musculoskeletal and respiratory. Respiratory is like a couple pages, but I will be sending the attachment to you, so you will be completing that at home. But it is going to be your responsibility to get the midterm to me once it has completed via fax, email, or scanned. Okay, and if you need fax number, just remember 678. I'll put it in the chat box, but it's 678-298. Gotta remember myself. 678-298-4741. Or you can email or you can just go ahead and scan it and email as an attachment. Okay, but I do want it before the end of day on Monday. So not this Monday. You won't even get it until, I'm sorry, I spelled my email address wrong, but you know my first name. Write that again. Don't be worried about the midterm. It's only going to be over what we've covered so far. So just think about the different parts of Medicare, that type of thing, when we did the intro. And then we went into medical terminology. You're going to see a lot of terminology on there. And terminology, again, you need to make sure you know, but you did a lot of terminology in week 2. And then the only coding you're going to have, you will have I-10 on there. So make sure you're good and comfortable with your guidelines. We did notes on a couple of things and highlighted a few key areas. Remember to make sure you read about sequencing, that type of thing. And then you will, as far as CPT, it will go over the integumentary, musculoskeletal, and respiratory. You can either send it to the grnottage at Yahoo, which is where I usually send out, or to the Geneva at Chronicles Billing. Either way, they'll still both come to my Yahoo address, actually. All right, so let me make sure I can get through this so we can do a few examples. Where did we leave off? Oh, we're almost done. Okay, that was the foot and toes. We did the feet. We talked about strapping, endoscopy, arthroscopy. So page 165. Yeah, let's just look at some of these, make sure we, just as a review, type of fracture. So open is, it's surgically exposed, and when it's an open fracture, there's going to be some type of internal fixation device. What are your internal fixation devices? Those are going to be either a graft or screws. Okay, percutaneous skeletal fixation. Remember that cutaneous means through cutaneous skin, through the skin. Okay, then they're attaching it to the bone, and they're saying it's neither open or closed, and pins are placed across the fracture site. Again, these are all repetitious. These terms should sound familiar to you, and some images should be popping into your mind with traction, skeletal, and skin. Those are fracture treatments, procedures. Wound exploration we spoke about, and I said the main thing I would be thinking about with wound exploration is going to be gunshots. Okay, we know where to find that. When they are doing a biopsy, very, very important. So if they're saying biopsy of a particular area, you want to know the depth. Remember, how far did they go? Was it just a soft tissue, to the muscle, or to the bone? So whenever they're doing a biopsy, whenever they're talking about the patients coming in for a biopsy, the question to yourself is, how far? So right now I'm not on a particular page. I'm just kind of reviewing, but I will be picking back up on page 165. 165 in the CPT. And remember, introduction or removal category, what's going on in there? So introduction or removal could be removing a foreign body. I said that would be one that they'll maybe ask you about. Injections, insertions, grafts, and implants. Those are the devices. Okay, because those are being introduced into the body or they're being removed, such as a foreign body. Okay. Under the general heading, there's different types of grafts. Yeah, bone grafts, cartilage, and the fascia, which is the one that's being taken from the thigh area. And then they have tendon and tissue grafts. Okay, and if you are coding for a graft, on page 98, it's a good little spot to write on your little tips. Where are the grafts obtained? Where are they obtaining the grafts? And here they have flaps. Look, flaps again, but in the musculoskeletal. Yeah, because they're talking about bone and skin flaps, right? Osteocutaneous flaps. And all you have to do, again, is where is it being taken from? Okay. Again, incision, excision, fracture. I think the terms are becoming familiar. They're very repetitious in this particular chapter. Again, where's the location based on an anatomic site? These where we were talking about the cervical, thoracic, and lumbar. And when you see L1 through L5 or T1 through T12, C1 through C7, they're called interspaces. Okay, and C1 through C2 is actually one interspace because they're in between, in interspace, in between the spaces. So where you see the number, if they said it occurred at C1, that's the first cervical little segment on the cervical area. T1, first segment on the thoracic area. And remember L5S1, that was because it's the last segment in the lumbar, first segment in the sacral area. Okay. And then we spoke about segmental and non-segmental. So when you get this PowerPoint, it's just going to kind of review what we have covered this evening. Okay, page 1, where do I want to go? 167. When we were just talking about on page 165 where it said endoscopy, arthroscopy, same scenario. I'm talking about two codes on page 167 right now. CPT code 29840, 29840, and 29843, 29843. Okay. Now you can see that those two CPT codes, both of them are procedures, right? The difference is one is diagnostic. Make sure you highlight it, put a box around it. 29840, one is diagnostic. And in 29843, it says surgical, right? Highlight it, put a box around it. Okay. So what does it mean? We need to know the difference. Remember, diagnostic, we're just looking. Just looking. We didn't touch anything. We didn't fix anything. We're just looking. Okay. Surgical is exactly what it means. We're on page 167. Yep. Surgical, there's actually a procedure being performed. So you can't do both, right? If you're going to do diagnostic, because they may say the patient came in for a diagnostic and then they ended up having a surgery. If they come in, the only way you can bill for a diagnostic is if they look and they don't fix. But if they look and they fix, then it becomes a surgical. You cannot bill a diagnostic procedure. If they have physically performed a procedure, then you cannot bill for diagnostic, because diagnostic is just, I'm just looking to see if something needs to be fixed. Or you're just checking it out with diagnostics. So just remember that surgical is actual hands-on, diagnostic is just looking, and you can't do both. Okay. You would just do the more extensive of the two. So it would be surgical. Okay, we spoke about cast, just making sure, catching up. Yep, that's where we are. All right, we're almost done then. Okay, I'm on page 168. Page 168. 160. Oh no, I'm sorry. Yep, 168. 168, CPT code. At the top of your page, as a reminder or a coding tip, I want you to write, does it include shaving? Does it include shaving on top of page 168? Yep, we're on page 168, and you want to write at the top, does it include shaving? Page 168. Does it include shaving? All right. For example, CPT code 29877. You need to know where the beginning of that code is, which is actually starting from, I think it is 29871. That's for arthroscopy of the knee, surgical. And then 29877 is saying that they're doing shaving, right? Go on down to CPT code 29881. This is saying that this is still talking about procedures on the knee. And it says with meniscectomy, highlight where it says medial or lateral. So either or, okay? And then go on down to 29883. And that says medial and lateral. Medial and lateral. Make sure that you highlight that. Okay. All right, page 168. So that seems like we just kind of went through musculoskeletal. These are some of the, when we come back to class, make sure you bring your hick picks. I want to just kind of, I don't think I've covered that at all. Very simple book to use. As a matter of fact, on the exam, there's only 5 questions from this book. Only 5. And of course, it would only be 5 questions from the easiest book to use out of the 3. But make sure that you bring it when you return to class. All righty. That's on the hick picks. Common modifiers in the musculoskeletal, because this is what also increased a lot of the I-10 codes, was the laterality things. So we have 50, modifier 50, which means the procedure was performed bilaterally or on both sides. Okay, or you can have RT for right, LT for left. So it's indicating the side, because remember, lots of fractures. It could be left arm, left leg, right leg. Modifier 59, we spoke about that a little bit too. Modifier 59 is a distinct procedure. So for example, anytime you see a separate procedure in parentheses next to the CPT code, you should say to yourself, this is a procedure that's usually performed by itself, right? So when you see separate procedure in parentheses, it's in reference to a procedure that's usually performed by itself. In the instance where it is performed with something else, another procedure, you make sure that you append modifier 59 to show them, hey, it's not usually performed with this procedure, but it was performed. So that's what modifier 59 specifies. And FA is for your fingers, indicating which finger, and TA through T9 identifies your toes. And on the front inside cover of your CPT book, front inside cover down to the bottom, you will see that they have the modifiers for the toes. And as you move up to the center, you'll see the FA through F9 for the fingers, right? And again, a full description of your modifiers in your CPT book is located in Appendix A, which is towards the back. And there's also modifiers in your HCPCS book. So that's going to be one of the things I'm going to want you to tab in your HCPCS, are the pages for the modifiers and your G codes. Thank you, Lauren, for sharing that info. All right. This was, I'll actually send you the link because this was actually a video. Anybody ever heard about the body exhibit? But this has actually a different spin on it, and it will be in the email when I send it to you. It actually shows where the bodies come from in the body exhibit, right? I think when people go down to Atlantic Station to watch that, they don't really think about where the bodies came from. But I do. And so after a little bit of research, I found this video. It was by, I think it's CNN. It was a documentary on CNN. And it actually showed that these bodies that are used in the body exhibit, the male ones, are from prisoners that they have executed. So that's really surprising. It's about 15 minutes long. So again, towards the end of class or at the end of class, when I send this presentation, you can click on the link and watch it. It's really interesting. I usually show it in class. It's about the body exhibit. Very interesting though, how they just dip them in hot wax. All right, so the need to knows, we got these already. You even have the page numbers. Right? Endoscopy, reduction. It should be reduction / manipulation. Either way, you need to know what the definition is. Vertebroplasty. We spoke about lipomas, and we know that lipomas are also called soft tissue or tumors. Right? And when you're looking for those, what do? You're looking at the location and the size. We know those start from page 116. Under the repair, revision, or reconstruction, it's just, again, what body part. And fractures or dislocation, remember the little blurb I gave about fractures and dislocation. If the patient has had a dislocation and a fracture, you're only going to code the fracture, not the dislocation, because the fracture is more extensive than the dislocation. Also with fractures, whether it's open or closed. And when it's open, we know that there's going to be some type of screws used, right? It's all sounding familiar. And amputation, and again, amputation and re-amputation, because sometimes that stump tries to grow on back. All right, we're not done. because I want to just look at a few questions. That's 30,000. Okay, let's look at this one here. All right. So, of course, I got to test you and just see. Well, this is just a quiz, right? It's just a quiz. I hate using this Mac. I'm trying to get used to it. All right. So, number one, can everybody see my screen? Can you see what I have up on the screen right now? Or do I need to make it bigger? You can see it? Okay. No, you can't see it. Okay. Can you see it now? Is it bigger on your screen? I can't even see my, hold on a second. We're gonna have to do it this way. They can't see. I'll read it out to you, but I just need you to listen. I'm only gonna do a few of them because I'm gonna send this to you for your homework as an attachment, so you will get a copy of this. But I just want to make sure you're getting the gist of what we're doing here with the musculoskeletal system. Okay, let me just stretch it out so I can read it. It's trying to, let's go up here. All right, so I'm on number one, which is right here. This really sucks on how it shows. Okay, so anyway, a patient is seen in the same day surgery unit for what? Arthroscopy to remove loose bodies, right? So when you're removing loose bodies, what would that be called? Okay, patient is seen same day surgery unit for arthroscopy to remove loose bodies. Okay, so you have some options here. 29805. Can you guys not see my screen? Okay, let me make sure you can see. 1 second. What about now? Still can't see it. All right, let's see how we're going to work this out. Yes, it's small. Words are quite small. Can you zoom? Okay. Try my best. No worries. I'm going to copy this and then paste it on a slide. No worries. Will I be able to do that? Let's see. I'll command. Aha. She's so special. All right. Can we see this slide here now, or are we still having issues seeing it? Screen went away. Nobody can see anything. Okay, back to PowerPoint. Can we see it? Okay. Woohoo! We can see. Great. Great. Does that help any? Is that better? Or is it just the same? Okay, as long as you can see, that's what's important for me. Oh, Lordy. Okay, just keep it still right here, Geneve. All right, I'm going to leave it there because everybody can see it here. Laura, don't laugh. All right, here we go. Patient is seen in the same-day surgery unit for an arthroscopy to remove some loose bodies in the shoulder area. What CPT code should this be? So remember, loose bodies, is that going to be considered foreign bodies? All right, type your answer in the chat box for number 1. Yep, Cherie, you're right. Anybody else? This is fun. And remember, guys, it shouldn't take you too long because here's the thing. This is an exam, right? This is how the exam is going to be given to you. Even if you're lost, you should have the page open. First thing you want to do when you see your questions, look at A, B, C, and D. See what they start with. It says 298. So before I even read my question, I'm already looking at the page with 298 on it. I don't know what they're talking about yet, but I found my page with starting 298, right? Because it's like 2980. So that's the page I'm going to be on. I'm giving you a test taking strategy. I'm going to have my 2980 page open. And now I'm going to read. Okay, and so once I see the term, hey, I see some answers coming into the box and everybody has it right so far. That was less than 2 minutes. Yes. Yes. Yeah. Removal of loose bodies or foreign body, right? That's the only one that tells you that. I don't know where my letters went, but the correct answer, oh, there, it's just shifted over. The correct answer, and I see most of you have put it into the chat box, would be D as in David. CPT code 29819. 29819. That's removal with removal of loose bodies or foreign body, right? Because it said arthroscopy. That was the key thing there. It said arthroscopy, which started on CPT 29806, but that just said arthroscopy, shoulder. It didn't say anything about removing the loose bodies, but it does in CPT code 29819. And like I said, you could have had the page open. Once you see the CPT, could have had the page open and then start to read through what the question's asking. Now you know what you need to look for, what detail you need to look for in your CPT code. Okay, so number 1 is D. Very good. Let's try another one. See if I can get the gist of how to do this. I'm not doing any I-10. We're just doing some CPT ones. Okay, let's try this one. Okay. Can everyone see the next question that's up here? I'll read it. All right, so the patient fell and keyword fractured. What did he fracture? His femoral shaft in 3 places. He also has to have, see, ORIF of the left femur with intramedullary nail and interlocking screws, and it's giving you the approach perichanterically. The orthopedist also places the leg in a plaster splint prior to leaving the office. Okay, again, what's our process on how we're going to look this up? I'm staring right at those CPT codes. What do I see? 275. Get there. Even if you didn't read it, I would have already gotten to 275 or 27, right? And so let's see what we're doing now. So so there's codes for you to choose from. 27245, 27507, 27506, and 27513. Answers in the chat box, please. Oh, that was good. Was that the one with a nice star next to it? Let's see, 27506, you guys say? All right. So, as you can see, we were able to break this down. And you see, we're getting the gist of this. Yeah, because we had ORIF. We even wrote it next to the CPT, right? So the correct answer would be D as in David, or CPT code 27506. Not bad. You know you have 2 minutes to answer each question. You guys are doing them in seconds. And you also have to think about, I always tell you, the how you want to take your exam. Think about the sections that are going to become easy to you, and that might be the path to take it. I know you did well with integumentary, so you may want to start with integumentary. You know, just have a plan. Okay, let's do another one. We'll do one more, and then I'm going to move on to respiratory. That's really short. It won't even take me 30 minutes to do respiratory, and then we'll conclude. But let's do one more. Feeling comfortable with musculoskeletal so far? Great. Yay! I am happy. I wish I could see. Can somebody put a smiley face there? All right. Yay! Thank you. All right. Let's do another question real quick before we move on. All right. Here we go. You got should already be at that page, right? Same area. We're still in musculoskeletal. What are we doing? We're turning to the 213s. Yep. We're going to turn to 213, leave the page there. I'm so excited. I just feel like we're taking a test. No problem. See you in a sec. All right. So, number 9. Let's see what's going on. Patient presents today for what? Closed reduction of nasal fracture. The depressed right nasal bone was elevated using heavy reduction. Hey, remember, reduction means what else? Manipulation, right? Using heavy reduction forceps while the left nasal bone was pushed to the midline. There we go again. That's something else. This resulted in good alignment of external nasal dorsum. What CPT code is reported? So now I know I'm at my 213s. I got 2 minutes. 213. Is it open or is it closed? We already says closed reduction. Okay, so that rules out A, right? What about B? 21310. That's closed treatment. But look, what does it say? It says without manipulation. I see you guys putting your answers in the answer box already. That means you're feeling comfortable with this, and that makes me feel comfortable. CPT code 21315. What are they talking about over there? 21315, closed without stabilization. I don't know about that. And then CPT code 21337. Love it. Says closed treatment. Nasal fracture with or without stabilization. Okay. Correct answer is D as in David, CPT code 21337. Perfect. Can I just do one more? Because you guys are just answering these so fast. I just got to make sure. All right, one more. One more. Last one. Promise. Until homework time. All right. Uh-oh. I would choose the one that's like, let me see if I can make this smaller. Is that too small? All right. Let's bold it a little bit so you can see it. All right. Another test taking strategy. Okay, let me see what number this was. 10. All right, go back here. Okay, another test taking strategy. What body system are we on? Musculoskeletal. So my answers should begin with a 2, right? Because your 1s are for integumentary. Get them out the way. This is even better. Now my chances are 50-50 instead of 1 out of 4. I like that. And then what am I going to do next? I'm going to turn to my 215. 215. I'm going to turn to my 215. I'm on page 116 somewhere. Okay. Now I'm going to read my question because I was like, okay, let's see what's going on. 63-year-old man. What does he have? A neck mass to be excised. Okay. So neck mass. So now that's another a little, also known as tumor, soft tissue, lipoma, right? To be excised. The neck mass, what else do we need to look for? We're going to need to know the size. We're going to need to know the size. I know the location. I just need to know the size. So now I know what I'm looking for. So you can kind of go on through and I'm like, lipoma. I see that there. That's a keyword. 5 centimeters. We should be done already. We don't need to even read the rest, right? Because we already know the size and the location. That's all we need to know to code. So we've already ruled out A and C. I see answers coming into the box like crazy. I'm so excited about tonight. I think you guys really picked up. I was worried about the webinar, but I think you got it. No one to break your concentration. You were just right into your books. Let's see. So let's just look at them real quick. 21552. I see 21552, which says 3 centimeters or greater, and we're talking about 5 centimeters, so that would apply. 21555 says less than. 21555. Am I reading it? Where is 21555? Oh, right there. Less than 3 centimeters. Okay, so it said 5 centimeters. So you guys are correct. Correct answer would be B. I'm sorry. Yep, B. 21552. Good job. Any questions on musculoskeletal, or does it seem to be pretty straightforward with how we kind of dissected through the chapter? Good? Okay. Not a problem. That's great. Everything seems to be okay. So we'll find out, right? Because I'm going to send you the quiz at the end. All right. I'll send you the quiz, but I'm glad to know that you feel comfortable with it. Now, real quick, I'll just shrink that down. I'm going to send that to you in a little bit. Real quick, I want to do respiratory. Now, if you turn to page It's not long at all. As a matter of fact, turn to page 172 or 170 is a good place for you to write your need to knows for respiratory. As a matter of fact, just so you know, in the 30,000s, cardiovascular also falls into the 30,000s. I'm not going to cover cardiovascular until after the midterm because it's a lot more extensive and I like to take my time with it when I explain it to you. But in the 30,000s on your exam, that's going to cover respiratory. Follow along with me. I'm on page 171. That's where your respiratory starts. Look, page 172, respiratory's done. Yay. I think you should be fine with respiratory, right? So that's only a page for respiratory. Everybody's like, okay, we'll take that one page. Who wants to be a respiratory coder? All right. And then after respiratory, it goes into cardiovascular, which is on page 189. And we're going to pick that back up. We're going to pick up cardiovascular after the midterm. So we won't be covering cardiovascular tonight because I want to make sure you understand it. All right, so cardiovascular and what else is with the 30,000s? Hemic and lymphatic and mediastinum and diaphragm are all in the 30,000s. And the reason I'm saying that, mentioning it to you, is because there's only going to be 10 questions from all of those sections, right? So you think about if there's respiratory, cardiovascular, mediastinum, and lymphatic, that's about 4 sections, but you only can have 10 questions. So you're maybe going to have about 2 from respiratory, 2 from cardiovascular, maybe 3 from cardio. They like to ask a couple more in cardio, and then the rest from the other 2, lymphatic and mediastinum, the ones that are listed here on this slide. Okay, so don't freak out about the 30,000s. A lot of people do get paranoid because they're thinking cardiovascular. I am going to make sure that I focus on those areas in cardio that they like to talk about, like cabbages, coronary artery bypass grafts, that's a cabbage, pacemakers. Those are the type of things that catheter placements. We're going to talk about those when you come back from midterm. But tonight, to wrap up, we're going to focus on the respiratory system. So right now I am on page 171. Uh-oh, not there. Okay, so you guys can see this. All right, so 171. I don't know if you remember, I think it was week 2 when we were talking about anatomy and physiology, when we talked about the respiratory system and how it is composed. On page 172 in your CPT, there is just a little diagram there, just a small one, but at least it still shows you the nasal cavity, where the larynx is located. So if I had to ask you what is located between the esophagus and the oropharynx, you'd be able to tell me epiglottis. So just remember that you do have images and diagrams in your CPT, also in your ICD-10 for all the body systems. Again, if you're not strong with anatomy, physiology, then you need to make sure you use your resources as much as you can. And just remember that they do have diagrams in the CPT and also in the I-10. But to keep it real simple for you, turn back to page 171. And you can see here on my slide, I have it in reference to the nose. Same thing like we were just doing in musculoskeletal. What do they find your body part? What are they doing to the body part? Okay, so when you think about nose, you know you're going to maybe have nose fractures, nasal polyps, or nosebleeds, epitaxis. Right? Or they're going to do biopsies. Okay, so let's go straight on into it. I'm on page 173. Again, under your incision category, I'm in respiratory under nose. Under incision, you're going to see drainage, right? Incision and drainage of either abscess or hematoma. Okay. The difference with 30020 is that they're talking about the nasal septum. So make sure you highlight nasal septum for CPT code 30020. Just want to make sure, you guys still see my screen, right? I don't know what I do when I do that. I think I shrink it. Okay, I'll just leave it there. Let me put it back. Hold on a second. All right, there you go. Okay, so, and the polyps. This is going to be important. You're going to have a question on this. I guarantee it. Under the excision section. So excision, you have your biopsies there. I'm actually looking at CPT code 30110. You see that it says excision. One was a biopsy. This one, they're actually removing the polyp, right? Notice that polyps has a S, right? That means it can be, single or plural, right? So it could be one or many because your S is in parentheses. Okay? So that means that it can be one or many. All you need to worry about is whether it's simple or extensive. And so remember the terms that we use for simple and extensive for the integumentary system, they can apply here. It can apply here. So all you're looking for is whether it's simple or extensive, and just know whether they say 1 or 50 polyps is still going to be that 1 CPT code. Okay. However, do pay attention to what's written right underneath that 30110. It says it's usually done in the office. So you better make sure you got office setting next to 30110. And 30115, 30115, look, hospital, because it's extensive. Hospital for 30115. Still polyps, still more than one or many. Just have to decipher whether it's simple or extensive. And usually in your question, it's going to tell you the location. Patient came into the office. Patient admitted to facility for removal of nasal polyps. Facility, okay, that's hospital, 30115, right? Easy enough? Okay. One more thing, right underneath it in parentheses, it has to report a bilateral procedure. You're going to use modifier 50. That means if you remove polyps from both sides. If you remove the polyps from both sides, you're going to add modifier 50. If your CPT description, yes, Sheree, it is fair to say that. If it is a simple excision, it's going to be done in the office. Extensive usually is done in the facility. Yes. So just remember that I actually wrote office next to those codes and on hospital next to the 30115. Okay, so remember, if it's a bilateral procedure, that means that the procedure was performed on both sides, then you would use a modifier 50. What I was going to mention was if it says bilateral already in your CPT code description, you do not need to append the 50 modifier because it's like you're saying it twice. So if bilateral is already included in the definition, then you don't need to add a modifier 50. And facility does mean, we use facility as kind of like an inpatient setting. So whenever we say facility, we're usually referring to the hospital. We're usually referring to the hospital. Move on down to CPT code 30117. 30117. What's important is they are destroying nasal lesions. Remember how you have lesions like in integumentary? And when we destroyed the lesions in the integumentary system, we needed to know how the lesion was destroyed. Well, with CPT code 30117, it tells you there, laser. So make sure you highlight where it says laser. Okay. Also on the same page, 173, CPT code 30220, where it has insertion of nasal septal prosthesis, that procedure would be done in the facility. So I would write facility next to that. Next to CPT code 30220. Okay, let's go on down more on the nose. Rhinectomy. Do they see that? Do you guys see that code there? Well, on the repair, look, they also have removal of foreign body, so you know where to go for the nose. Again, all of the procedures under that body part are going to be grouped together. So as long as you know where the body part is, and now we know what they're getting ready to do to that body part, you should be fine in this area. So you can see the removal of foreign body. Then we go into repair because we're talking about the nose. Now we're starting to use our terminology, right? So we have rhinoplasty, which is a surgical repair of the nose, which is CPT code 30400. If you move down to CPT code 30430, you'll see that's a secondary rhinoplasty. Make sure you highlight that. And then CPT code 30460 is for the deformity of the rhinoplasty. I don't know what plastic surgeon they went to, but they're going to have that repaired. Page 174. Page 174, septoplasty, CPT code 30520. Make sure you put a star there and highlight septoplasty. So again, we're still continuing on with procedures of the nose. And then they have your accessory sinuses. Look at CPT code 31020, sinusotomy. There's also one for CPT code 31050, but you see it has a different approach. On 31020 it has maxillary, and on CPT code 31050, it has the sphenoid. And another part of your accessory sinuses, you have your ethmoid, which is under CPT code 31200, removing the ethmoidectomy. Move on down, endoscopy. Okay, this is always talking about, whenever you see endoscopy, remember we were talking about diagnostic and surgical, the difference between the two? That's what this is. This little spill is about right there on page 175. Some of your questions are maybe going to come from page 176. Page 176. All right, CPT code 31235. It says nasal and sinus endoscopy. Make sure you highlight where it says diagnostic. So in CPT code 31237, what are you going to highlight? Where it says surgical. Okay, so that's surgical. And 31238, they're actually controlling nosebleed. See, with control of nasal hemorrhage. But jump on over to page 177. Look at CPT code 31287. You got to be careful, right? Because that also says nasal sinus endoscopy, and it also says surgical, but they are mentioning the sphenoid. They're cutting into the sphenoid, so make sure you highlight that one because it specifically mentions the sphenoidotomy. That's opening, artificial opening. And with 31237 on page 176, that's in reference to a biopsy. All right. So you can see on this page, they're talking about the sphenoid on page 177. I'd maybe make sure you highlight that. And on page 176, it's more about biopsies. Okay. Then you move on to the larynx. See, we're done with the nose. Real quick. Same protocol. You have excision here. Laryngotomy. That means they're cutting into the larynx. Laryngectomy. CPT code 31360. Okay, what was the last one? Okay, Tiff, I hope I'm giving you the right information. The last one we were just talking about the nasal and sinus endoscopies. So highlighted, you should have 31237 with surgical highlighted there and underline biopsy. And then on page 177, CPT code 31290. And 31287, making sure you highlight where it says surgical and then underlining or highlighting where it says sphenoidotomy. Moving back on over to the larynx, turn to page 178. So you can see all of these are just procedures on the larynx only. Not much to do, right? You have excision, introduction, endoscopy on page 178. You start off with the repair, and that's it. Same thing for the trachea. One question I know they're going to ask on page 179. Put a star next to CPT code 31603. 31603. That is a emergency trach. So make sure you highlight. Look, there's two of them. 31600 says planned, right? It also says separate procedure. So in your head, you're like, okay, this is supposed to go by itself. If it goes with something else, you're going to use what modifier? 59, right? And it also gives you the age. 31601 is younger than 2 years old. But CPT code 31603, the emergency procedure, that's the common one. So I want you to highlight that, put a star next to it. And then go all the way down to 31613. That's for the revision. The revision. Then it starts on your bronchoscopies, 31622. 31623, make sure you highlight where it says with brushing. And CPT code 31625, where it says or endobronchial biopsy. With bronchial or endobronchial biopsy. And make sure you highlight where it says multiple sites. Okay, let's keep going. Let's see if there's any need to knows. Not yet. I'll go over those. Well, I'm going to actually give you the need to knows all together after we have completed the other sections, because remember, they all go together. So for the respiratory, I can send you the need to knows, but we still need to cover the other sections that go with the 30,000s, but I'll still send those off to you this evening. Let's see, page 174. Put a star. Oh, we already did septoplasty. We did that. Okay, so I'm on page 180. Page 180. So we've already gone through the nose. Polyp removals, biopsies. Okay. We spoke about accessory sinuses, the larynx. Okay, so when you're coding for the larynx, what's important here, like they've stated, is the approach. So make sure on what page was the larynx on? Page 177. Pay attention to the approach of some of the procedures, but you will. Let's see, neck dissection. Anytime you see the term, sometimes they'll say radical neck dissection. Sometimes you'll see the word radical. Anytime you see the word radical, it often is severe because it does say radical, but they're removing the lymph nodes. They're removing the lymph nodes. Okay, someone's saying they're having problems hearing. Can everyone hear me okay? Okay. Everyone's saying yes. So if you're having issues, sometimes what I suggest is that you hang up and dial back in. I'm glad you can hear me now. Okay, see it. No problem. Okay, so again, radical. If they ever say a radical removal or radical neck dissection, they're also removing lymph nodes. Just remember that. So radical is more extreme. We just spoke about the larynx. Endotracheal intubation, that would be CPT code 31500. 31500. That's going to be found on page 177 under the introduction. Intubation endotracheal emergency. That's a common procedure, and we're going to revisit that code again, 31500, when we start coding for E&M. When we start doing E&M, that's a common procedure that happens in the emergency room. Okay. All right, we did multiple sites on that. All right, turn to page 180 and look at CPT code 31628. And make sure you highlight where it says transbronchial lung biopsy. But also underneath that CPT code in parentheses, I need you to put some arrows, some stars, some fireworks pointing to this little blurb here in the parentheses. It says 31628 should be reported only once. I have that highlighted with a box around it, regardless of how many biopsies are performed in a lobe. So regardless if they said there was 3 biopsies, because I know we have a tendency to want to do or say times 3, right? This CPT code is saying no matter how many biopsies, lung biopsies are performed, we're only going to use that code once. So make sure you highlight that and put a star next to it. All right, what other page do I need? Page 182. On page 182, where it says other procedures and it has lungs and pleura, put a star next to that. That's going to be some nighttime reading to help you go to bed. You need to read that. Okay, halfway down, well, a little bit more than halfway down. If you look at the paragraph on page 182 from the bottom, Not where it says when diagnostic, but you go up a little bit more. It says pleural or lung biopsies or diagnostic wedge resections. I need you to highlight that part. Actually, you're just going to read, just make sure you read that section on page 182. It just talks about the different procedures for like wedge resections. It's talking about wedge resections on the lungs and pleura. And you maybe won't have a question about it, but I just want to make sure I bring it to your attention because they also talk about the VATs. Anybody knows what VATS stands for? VATS. Okay. It stands for video assisted thoracoscopic surgery. Okay, so now you know that basically they're having some type of imaging guidance in order for them to do to cut piece of your lung. I would hope that they would look with some guidance. All right, so that's what VAT stands for, video assisted thoracoscopic surgery. Video assisted thoracoscopic surgery. Okay, let's keep going. This section actually is not very detailed, but and it's not hard at all to code. The thing that you really need to pay attention to is whether, especially with the nose, whether things are done bilaterally or if it's just done on one side, making sure, you know, whether you need to use that modifier 50 or not. But the coding itself for this section very simple because there's only a few sections, right, that fall under respiratory. And as long as you know the body part and what's actually being done, you're going to be okay. And again, if they have the term like a procedure, like on page 182, where it has thoracotomy next to CPT code 32111, I'm sorry, 32100, you can also look that up in the index. So, you know, remember there's multiple ways, but because this section is so short, because respiratory is so short, I would maybe just look for my body part starting on page 171, because I know it's only page 171, 172. I would just look for my body part and figure out what they're getting ready to do. Are they putting something in, taking something out? So it's going to take me straight to the page I need to go to. So this isn't a difficult one at all. And the VATs, I was talking about the VATs. If you turn to page 185, you can see there where they place the endoscope to view. You can see the image there where they place the endoscope. Yeah, they would definitely need to see where they're going. So that's what the VATS is all about. VATS. All right. Let me show you how simple this one is. My favorite thing to do. Let's see. I'd rather just do a few examples. Oh, it's 9:30. I'll just do 2 examples. Just want to make sure we went through these, and I will be sending this to you. All right, let me show you how easy this is. And these will maybe be the shortest questions that you will have on your exam as far as question length. Let's see if I can do this here. All right, here we go. Now, I don't like the way that came out. All right, it's a little bit all over the place, but I think we can make it out. Okay, so here's a question up here. What CPT code is reported for a percutaneous needle biopsy of the mediastinum? Okay, well, first of all, that's not respiratory. But if you turn, let me tell you how you could do this. You could also go, let's do this like we were just getting a coding question. So I want you to go to the index. So you can see how easy it is. And what's the actual procedure? They're getting a biopsy of the mediastinum, right? All right, look how easy it is. Go to the index, go to biopsy, and you're going to look for mediastinum. Look at you guys, Speedy Gonzalez. Answers in the chat box already. You're going to go biopsy. So biopsy starts on page 794. What are we taking a biopsy of is going to be the mediastinum. And then once we get to mediastinum, they give you 3 selections, right? So we need to know what kind it is. And it told us in our question, needle, right? So it tells you right there. And I see a few of you. I'll wait for a few more in the chat box. 2 more people, please. See your answer. 1 more person. Too easy, too easy. Thank you very, very much. So yes, you all are 100% right. 32405 is the correct answer. 32405. And the letters are all off, but you know your CPT code, and that is correct. Let's do 1 more. This is going to be easy because I just spoke about this. Let's see if you'll remember. Because you're going to see this on your exam. Let's see if you can recall what I just said. All right, what CPT code is reported for an emergency endotracheal intubation to save the patient's life? Remember I said it's done, you're going to see it a lot because it happens in the emergency room. What CPT code would that be? Two more people, please. Emergency endotracheal. That's the key word there, emergency. Endotracheal intubation. Correct. CPT code 31500. Good. All right, 1 more. You know me, just 1 more. All right. Last one. You don't have to drive far to go home, right? All right, last one. Here we go. Johnny has a penny removed from his left nostril, right? So we already know what the body part is. And if he has a penny, it does not belong there, right? So that's going to be considered what? Foreign body? See how easy this is? So Johnny has a penny removed from his left nostril in the doctor's office. What's the CPT code? We already know what page we should be on. Starting with what? 30? We're getting the hang of this. Starting with 30. Just a couple more answers in the chat box, please. Not one person missed it. Perfect. Correct answer, CPT code 30300. And that's basically how respiratory is. So if you found that really easy, then that's maybe part of your strategy exam. Everything I'm going to talk about with you guys is going to be relating to the exam. Tonight we covered musculoskeletal and respiratory. And we also covered some techniques, some test-taking techniques, which I hope are helpful. So you have an idea. The exam's going to look just like your homework questions, right? So everything's multiple choice. So again, if you turn the book or the page, to the first 2 codes or 3 codes in that CPT, you're already halfway there. And if you think about where we are, what body system we're in, that's going to help you even more. Sometimes that will narrow it down to 50-50 like we saw on some of the earlier examples. Okay, so what I'm going to do tonight, well, give me till tomorrow, but I am going to email you the attachments for respiratory, musculoskeletal, and also the need to knows. So that's respiratory, musculoskeletal homework, respiratory homework, your need to knows, along with the PowerPoints. And then next week, Thursday, this is an announcement for everyone. I'll also put it in the email again. But please remember that next week, Thursday, there will be your class. It is an active class. It's considered your midterm, but you'll be taking your midterm from home. So I will email you the midterm on Thursday morning next week is going to be your midterm. You are to return the midterm to me before 11:59 p.m. Eastern Time on Monday. Okay, how are you going to send that to me? You can either send it via fax, email, or you can scan it as an attachment. And it needs to be completed. There will be no blanks. Okay, you don't leave any blanks. You also want to make sure that you time yourself. You should be giving yourself 2 minutes a question. So if there's 75 questions times 2, that's 150. So what's that, 2 hours and 30 minutes? Is that right? Well, we're not going to have a Scantron because I'm not going to have the option to give those to you. So you're just going to circle your answers on the midterm and then send a copy of that exam to me. I know it's going to be quite a few pages, but it's important for me to see it too because I want to see what you're highlighting. Please make sure that you highlight in your questions. And when I say highlight, meaning I want to see the keywords because I can see what you're pulling out and I can also see if you're missing key items that will help you with your questions, right? So I do want to see your work. That's why I want you to either fax it, scan it, or email. So do we need dates? Let me see. Well, you don't need dates. Where are we? Okay, so today's the 8th. So I'll have everything, all of these attachments that we discussed tonight, you'll have them on the 9th. On September 15th, you will be taking your midterm at home, right? So September 22nd, although you're going to either email, scan, or fax a copy to me by the 19th, still bring your hard copy to class when we resume on the 22nd. Okay. Does anyone have any questions? Let me just open up the lines. So if you have anything going on a little weird in the background, let's get it under control. I'm just going to unmute everyone. So if you have any questions, you can take that time and ask them now.